So, as Sister Shola said, my name is Dr. Ihezie. I'm an ambulatory care pharmacist, and we're going to have a discussion about hypertension today. Okay, so my slides are showing. So if you go to the agenda, we're going to just be talking about what hypertension is exactly, what causes hypertension, what's the big deal about it, why is it that serious, like who cares, and let's get down to the numbers, and then what you can do to prevent hypertension, and then I will take some questions at the end, okay? So raise your hand if anyone in this room has ever heard of the term hypertension. Please, I want to see your hands. Have you ever heard of hypertension? Okay. Have you ever heard of high blood pressure? Yes, okay. See, that's what we all know, high blood pressure. So the medical term for high blood pressure is called hypertension. And what hypertension is the pressure that your blood puts on the walls of your arteries and your veins. So because your blood is a fluid, it produces pressure, and as your heart pumps it, that pressure can increase or decrease. So it's normal that your blood pressure can go up and down throughout the day. That is very normal. However, if your blood pressure levels remain high, that is what we know as hypertension. So there are a few things that cause hypertension, okay? You're not going to wake up tomorrow and have high blood pressure. It's something that occurs slowly over time, and it can develop because of a number of different factors, such as unhealthy eating or unhealthy lifestyle choices, like a sedentary lifestyle, not getting enough regular physical activity. Certain health conditions can also cause hypertension, like diabetes, obesity, and also pregnancy. Pregnancy is a condition that people don't also realize can cause hypertension. That is known as eclampsia or preeclampsia in pregnancy, because when you're pregnant, you have a lot more fluid in your body, so that can lead to hypertension in certain patients. It doesn't happen in every pregnancy. So what's the big deal? Like, what's the big deal about hypertension? Well, if you have hypertension and it goes uncontrolled for a long time, it restricts blood flow to your major organs. So this can cause damage. It's known as the silent killer. Has anyone ever heard of that term? Hypertension being called the silent killer? So it's called the silent killer because if it goes unchecked, it can lead to many different diseases, such as chronic kidney disease. It can lead to a heart attack, heart failure, stroke, chest pain. I'm going to stop really quick and just go over what some signs and some heart attack signs and symptoms and some stroke signs and symptoms, because I believe that these are also very important when discussing hypertension. And some people may not notice that they're going on because, like we said, it's a silent killer. So you want to be able to recognize some of these symptoms that I'm getting ready to discuss, just in case it may be happening to you or one of your family members or friends. So some symptoms of heart attacks are chest discomfort. So that can be a very tight pain in the middle of your chest here. It can also radiate to your left side, your left arm, your left shoulder. So it can feel like a tightness or a pain. It can feel like a squeezing sensation, or even a numbing sensation. Women also, when they have heart attacks, women can have pain in their lower back. Women can have pain in their jaw or in their stomach. So it may not always be in the chest. Some women tend to present with these other symptoms versus just the typical chest pain and arm and shoulder pain. Shortness of breath is another sign of a heart attack, and other small signs like lightheadedness, a cold sweat, or feeling nauseous or dizzy. So those are all signs to look for if you think someone may be having a heart attack or yourself. And stroke, I want to talk about symptoms of a stroke. Stroke symptoms are a lot different than heart attack symptoms, but the thing about when you think someone is having a stroke is you want to act fast, okay? Time is of the essence. You don't want to waste time, and the sooner you get the person medical attention, the greater their chance of survival, because stroke and heart attack can be very deadly. So some signs of a stroke that I want to discuss are face drooping. So one or both sides of your face can droop. So a good way to check for that is to ask the person who you think might be having a stroke to smile. If they try to smile, one side may not curl up like a normal smile does. That's a sign. Arm weakness too. You can ask the patient to extend both arms like this. Sometimes they may not be able to lift one arm. That is a sign of a stroke. Also, speech difficulty. They can slur their words. They won't be able to repeat a certain sentence or a simple sentence like the sky is blue. They may mumble or slur their words. If you notice anyone having any of these signs, call 911 immediately. Get them medical attention as soon as you can. Okay, so that's why it's a big deal. That is why hypertension is a very big deal, because it can lead to some of these issues that can be deadly. And we want to make sure that we are being proactive in our healthcare to prevent this from happening. About 1 in 2 people have hypertension. So that's about 50% of people in this room. Half of this room may potentially have hypertension based on the statistics. So it's very common. It's something that is very, very common and can just go without being treated because it's a silent killer. So let's talk about hypertension, the numbers, okay? So there's 2 important numbers when we're talking about hypertension. Systolic blood pressure, which is the top number, because a blood pressure reading is 2 numbers, usually a top number and a bottom number. The systolic number is the top number, and the diastolic number is the bottom number. So normal blood pressure is considered systolic blood pressure of less than 120 and diastolic blood pressure of less than 80. So your blood pressure reading be less than 120/80, that is considered normal. Elevated blood pressure is anywhere from the top number being 120 to 129 and the bottom number still being less than 80. That is considered elevated blood pressure. But high blood pressure is considered the systolic number being higher than 130 and the diastolic number being higher than 80. So please get your blood pressure checked. Even if you think that you're healthy, it's still important to get your yearly physical. During your yearly physical, your doctor will check your blood pressure and they'll be able to see if it's trending high or if it's normal. So what can we do to prevent or manage high blood pressure? So many people with high blood pressure can lower their blood pressure into a healthy range without having to take any medication, just by doing some modifications to their lifestyle. Some of those modifications could be getting some exercise. So exercise is very important just for cardiovascular health in general, but also to lower your blood pressure. So the American Heart Association recommends at least 150 minutes of exercise per week. So if you break that down, that just breaks down to about 30 minutes of exercise 5 days a week. Not too bad. It's definitely doable. I know sometimes we get very busy with our day-to-day schedules, but taking a walk in the evening with your family, maybe after dinner, or, listening to your favorite podcast or your favorite playlist and walking on the treadmill or anything, riding a bike, swimming, all of those activities are considered exercise and can help increase your movement and lower your blood pressure. Also, not smoking. Smoking cigarettes is a direct cause of heart attack, stroke, high blood pressure. So just not smoking, simply not smoking, will reduce your risk of developing hypertension. Eating a healthy diet. So we're talking about limiting your salt intake and limiting fried foods, and also limiting alcohol. Those modifications can also assist with lowering your blood pressure. Keeping a healthy weight and managing your stress. So I know that we are all stressed. I know, raise your hand if you're stressed out. I know I am, okay? But we also have to find ways to manage our stress. One way that I like to manage my stress is I like to work out. I like to run outside. I like to get on my bike. And I also like to get massages. So, I'm just saying, I'm not saying that you have to get a massage to manage your stress, but what I'm saying is utilize a form of self-care that will help reduce your stress levels and thus reduce your risk of developing hypertension. So, use it as an excuse. Hey, I need to go get a massage because I'm working on my self-care and I'm managing my stress so I won't get hypertension. And I'm sure there's plenty of other ways that we can manage our stress. Some people like to read. Some people like to do yoga. Some people, anything that you consider an activity that helps take your mind off the stressful events in your life are good to implement into your daily schedule to reduce your risk of developing hypertension. Okay? So I'm happy to answer any questions, if there are any questions that anyone has. Otherwise, that's all I have for today. Yes, Elder Michael. Does the reading of blood pressure have anything to do with age? So, yes and no. So, sometimes as you get older, different, your lifestyle can lead to that. High blood pressure is caused by your blood vessels being restricted. So sometimes when your cholesterol is high, that can also lead to hypertension as well. So I wouldn't specifically say it has anything to do with age, because you have people who are up in age who do not or have never had any blood pressure issues. So the main thing is just having that healthy lifestyle all throughout your life. If you make those good choices all throughout your life, when we get to your age, Elder Michael, we'll be healthy. So it doesn't necessarily tie into age. It's more about your lifestyle, your diet, and how you live your daily life. Any other questions? Yes, Brother Fred. Okay, that's a good question. So it's good to check your blood pressure in the morning when you wake up and in the evening before you go to bed. It's better to take it seated. Okay, you want to make sure you haven't been walking around or running around. You want to sit for 5 to 10 minutes, allow your heart rate to come down, and then check your blood pressure. And then you want to make sure your arm is at heart level. So you don't want your arm to be down here when you're checking your blood pressure. You want your arm up, and you want to check it at that point. Oh, and I also wanted to discuss medication. If you have been put on medication for hypertension, it's important to take it every single day. And it's also important to go back to your doctor for follow-up appointments and to get your blood pressure checked. So that way they can see if the medication is working for you and make adjustments if necessary. So if you're not going to your doctor, they're not going to know if your blood pressure is being managed correctly. Brother Fred? Yes. So I would say doing more cooking. I know cooking is not for everybody, but there are recipes and YouTube videos and tutorials that can help you cook your own food. Cooking your own fresh food is the best way. A lot of prepackaged items, like you said, contain a lot of sodium. And there are seasonings. I don't know if anyone's heard of the Mrs. Dash seasonings, but the Mrs. Dash seasonings contain very little or no salt, and they're still very flavorful. And so you can, if you're cooking your own food, you're buying your own groceries and cooking, you can buy those seasonings and use that to season your food, and that's a good way to reduce your sodium intake. That's a good question. I'll have to get that answer for you. I don't know it off the top of my head, but I can get it for you in a minute. Any other questions? Yes. What are some other healthy habits that you can adopt? No problem. So like I said, being active, I feel is very important. It helps strengthen your heart. When your heart is strong, it can pump your blood more effectively, and it can get your blood through those vessels. So staying active and just eating right, getting your rest too, sleeping at night. People underestimate how important sleep is. Getting your rest is also very important to reduce your risk of hypertension and to help manage your stress. So all of those factors are important. But stress levels too. Stress. I can't stress it enough, but having high stress levels can increase your risk, because stress manifests itself physically in the body in many ways. So it's very important to manage those stress levels. If you have a stressful job or a bad boss who's putting a lot of pressure on you, maybe look into switching departments or finding another job, because your life is more important, and your life is literally at risk when you put yourself into stressful situations. So that's my recommendation. Any other questions? Yes. Yes. So family history is very important. Sometimes you can do all of the right things. You can be eating well, getting your exercise, managing your stress, and you still have high blood pressure. And that's when it is genetically linked. So at that point, the best way to take care of yourself would be to go to your doctor visits. Make sure you're, scheduling your visits when you need to. Make sure you get your blood pressure checked, and make sure that you're taking your medication that is being prescribed to you as prescribed. That's the best advice I can offer for that. Yes, Elder Kwame. I couldn't hear. Salad dressing that is not good. Is that what you said? Salad dressing that is not good for you? Salad dressing. So honestly, the healthiest salad dressing would be any kind of vinaigrette dressing, but you want to check for the sodium levels in it. Some people make their own vinaigrette dressing using olive oil and a little bit of seasonings. That's the healthiest way. It may not have that taste like ranch or Caesar, but it is the healthiest version that you can, salad dressing that you can take in. So that would be my recommendation, honestly, making your own vinaigrette dressing or buying vinaigrette dressing from the stores, but just making sure that the sodium levels are not very high. Yes? Only as your doctor prescribes. Now, those changes that you undergo can bring your readings down to where you don't need blood pressure medication anymore, but your doctor has to give you that okay. So that's where making sure you go for your blood pressure checks and your follow-up visits are very important, because I've seen it with my two eyes where I've had patients who made those lifestyle modifications and completely got taken off all of their medications, but you should only do so as your doctor directs you. Okay? Yeah. Anybody else? No? You don't have a question? Okay, that's it. Thank you. If anyone else has any questions, you can come see me. Thank you.